The Gauteng Health Department is urging members of the public to be wary of malaria, especially those traveling from hotspot areas. Gauteng Health MEC Nomantu NkomoRalehoko yesterday called on people to seek medical attention, especially if they're experiencing symptoms. We're joined by the Gauteng Health Department's Deputy Director. This is Tebogo Matjokotja. Tebogo, good evening to you, and thank you so much for your time. Firstly, what are we seeing in Gauteng in as far as malaria cases are concerned right now?
Good evening to you, Kathy, and to the viewers as well. As far as malaria is concerned in Gauteng, as the minister has alluded on Sunday, we have reported 1,103 cases as from January to September, with 11 deaths being reported, and we're expecting to see more of the cases as we are now on the malaria season. We start from September up until May the following year. So this is a malaria season, and we are expecting to report more numbers.
What is it that you need members of the public to know the most about dealing with malaria?
Our plea about what people need to look out for is, as Gauteng province, we are the non-endemic area, meaning that we don't have a parasite, the breeding parasite that causes malaria. However, most of our cases that we are reporting in Gauteng province, they are from the endemic areas, such as Mpumalanga, Limpopo, as well as KwaZulu-Natal, and not also excluding most of the African countries, our neighboring countries, where most of our cases are coming from Mozambique. So what we are urging our viewers is, as they are traveling, as we are in the traveling season, and people are about to go to the endemic areas, we are urging them to take a prophylaxis, which is a doxycycline, which is free of charge in our facilities. So people should take this a day before they leave or travel to the endemic area. And while they are there, they need to continue with the medication. And when they come back, they should also be taking this doxycycline for a period of 4 weeks, which is 30 days. So that's the message that we want to put across. And the other thing that we want to discuss tonight is we are urging, especially those travelers that are going to Mozambique and Malawi, as well as Ethiopia and Zimbabwe, that as they come back, if they are feeling any kind of sick, they are having some headaches, some chills, we are pleading to them that they should seek medical attention very early, because most of the cases or the death that we are reporting is because our patients, they come to our facilities very late, and they don't even disclose their travel history. So travel history needs to be disclosed so that there's no delay initiation of the treatment.
Gauteng often becomes a stopover for many people that are traveling in the region. How much of an effort are you going to be making in as far as awareness campaigns are concerned, given just the amount of foot traffic that you get in the province?
As you might be aware that the 6th of November each year is a SADC Malaria Week. So as the Public Health Directorate, the Department of Health, so what we do is we are having some health promoters who are on standby, and then they go to the communities, educating people, especially in the hotspot areas where we know that we are having a high number of cases of malaria. We are having the health promoters that goes to the public, and then they educate our communities about malaria. And we are in partnership with the bus and the taxi ranks, where mostly the commuters who are commuting to the endemic area, we will be giving the health talks and also guiding them what kind of preventative measures they can be taking as they are traveling to these endemic areas. So Gauteng, throughout the year, because we are celebrating malaria twice, it's in April on the 25th and also on the 5th of November. We are also running some training to our clinicians so that they don't miss the cases of malaria. especially during the season of malaria. That's where we are doing most of the education and also capacitating or reminding our clinicians as well that they must be look out of these cases.
All right.
So that's what the department is doing. There's a lot of awareness that is happening in the communities.
Gauteng Health Department's Deputy Director, Tebogo Matjokotja, let's leave it there tonight.